everyone, and welcome to Say Hey podcast. It's where we delve into the minds of geniuses. And today, we truly have a genius with us, all the way from New Jersey, United States of America. My name is Hassan Yunus.
And my name is Sarifa Alonto Yunis. And welcome to our Say Hey podcast with our guest all the way from New Jersey, Carolyn DeLucia.
Maybe before we go to the books, I'm just questioning regarding what you just explained about the hormones.
Yes.
So obviously, men and women, they have different hormones, right?
Hormonal changes.
For men, testosterone. For
Yes.
women, I don't even know what the hormone is called. I know that it's for men, testosterone. So basically, as men age, their testosterone levels also drops, right?
Yes.
So
Yes.
I'm thinking that's the same case with women.
Yes.
Is that right? So their hormone levels also decreases, so which makes a double negative effect, so to speak, in that sense.
Absolutely. And I'm glad you mentioned that, Hassan, because I am a gynecologist, but fortunate to be in the United States where I may treat men as well because I'm a medical doctor. And as long as I'm licensed, I can treat men as well, even though I'm an OBGYN. So I do treat my women's partners if it's needed. So what that means when it comes to menopause, which is
Going there.
I just realized that.
yes, menopause or adrenopause.
Menopause. That's a menopause.
Yes. And getting back to you, Sarifa, you said that we expire. I always say men get distinguished. We get extinguished. It's not fair, but we can fight that. And I share all my tricks.
We
But
can
when it comes
now our expiration date with your help.
exactly.
I have a feeling.
I love that.
Yeah.
But when it comes to, go ahead, Hassan.
No, that's right.
So getting on with testosterone in men, it is unbelievably critical. And I use bioidentical hormone therapy. My preference is pellets. Pellets are a compound of 100% identical to what our body makes, plant derived, so no chemical compound in a chemistry lab, that are placed under the skin in fat tissue, preferably in the buttocks area. And these pellets dissolve slowly and gradually in men over 5 to 6 months. So they only have to be placed twice a year. And in women, 3 to 4 months. Of course, we have to go through everything more, but that's okay. And we have the resilience. But when it comes to the effects, when a man loses his testosterone, not only do they lose their erectile function, but I'm going to get to that in a second. They also are moody. They have no energy. The weight distribution begins to come to the middle of the abdomen in men. That's why they get that beer belly, as called in the United States. They may never touch a beer, but the weight goes in that area. And that is all a sign of dropping testosterone. Men will lose 1% testosterone over the age of 30 every year. And when it drops, the normal range of testosterone is around 300 to 1,000. When you have a level of 1,000, you have protection against Alzheimer's, diabetes, heart disease, metabolic syndrome, and all the way down at the very bottom, you must be below 300 in order to lose erectile function. Here's the key there. That is nature's way of preserving the species. And most men won't seek help because they think they're fine until that happens. But by then, they've already got cardiovascular disease. They've already got muscle wasting. They can't build their muscle when they go to the gym anymore. They are fatigued. And all of that is due to lack or dropping testosterone. So once it falls below 500 or in that range of 300, you can safely replace it and optimize aging health in men. And the same goes for women. Women need testosterone as well. Our ovaries make 3 hormones: testosterone, estrogen, and progesterone. And in our reproductive years, these levels are natural and necessary. As we age, they diminish. And without estrogen, the skin on our face will sag, we will get wrinkles, there's lack of moisture in the tissues, and we get hot flashes, night sweats, mood swings, and the change in the intimate tissues. In lack of progesterone and testosterone, we can't sleep at night, and there's lack of sensation, lack of libido, and mood swings. A melancholy sets in. It's like a gray cloud that comes upon us when we lose these hormones. And by simply and safely, if that's indicated for the individual, it's a way of optimizing our aging health.